Welcome back to another lecture, and we are looking at lesson 2, which is anxiety disorders of abnormal psychology. Um, this is your host, Dr. Tulipo Mwenfumbo. You can order the book for more information on this course, which is Abnormal Psychology by Dr. Tulipo Mwenfumbo. And we have got also different books that are on sale, which I've written. I've written the book Psychology, and we have Introduction to Psychology, Paralegal Counseling. I've written the book Human Resource Management, and also we have got Human Development Psychology. So there are a lot of books that you can order. A lot of books. We also offer programs. Our programs are 100% online. We offer program in different disciplines. So we offer research and also online degrees, diplomas, and also certificates. So you can register in any of our programs, or you can request in any or to do any of our programs. Can contact me on +260 18 12 53 +260 976 18 12 53. This is your host, Dr. Tulipo Mwenfumbo. Once again, welcome. If you have not subscribed, you can subscribe to my channel so that you may be updated in whatever that is happening. Not only that, you can also be able to like the video and leave a comment, and if there is anything that you want us to improve, you can comment on the comment section. In lesson 2, we are looking at anxiety disorder, and we are going to look at definition and symptoms of anxiety disorders. We are also going to look at causes and risk factors for anxiety disorders. We are also going to look at treatment options for anxiety disorders. Let's move on. What is anxiety disorder? So when we talk about anxiety disorders, it's a group of mental health conditions that characterized by excessive, persistent fear, anxiety, or worry that interferes with an individual's daily life. So there are a lot of disorders in this section. So to understand more disorders in a specific way, you can order this book, and you are going to find this information where they are different, where the disorders, mental, which is called anxiety disorders, are characterized. Now, today we were just going to look at the overview of anxiety disorders, because we cannot manage to go into details because of time. I want to keep the lessons short and to the point. So, these are mental health conditions characterized by excessive, persistent of fear, anxiety, worry that interferes with an individual daily life. So you would find that this person has just developed fear of an unknown, fear or anxiety that can be or that is a mental disorders. So how do you diagnose this mental disorder? By using what is called clinical diagnosis. So in the clinical diagnosis, you use what is called symptoms. So the symptoms that you see in somebody who is having who is having anxiety disorder is: number one, um, excessive fear or anxiety, where this person has got that feeling of fear, anxiety that is out of proportion to the situation. There is just that excessive. Somebody is just traumatized over something that is not, he or she is not supposed to be traumatized. That can be the symptom that this person is suffering from what is called uh, what is called anxiety disorder. Then less stress or feeling on edge, where this person is not at easy. It's like is is less stress, feeling less stress, on edge, or easily irritated. So that can be the symptom of anxiety disorder. Because of fear, this person maybe has developed the fear for some times, maybe is afraid of something. So that can be a disorder that this person may be facing. The other thing, it is difficulty concentrating, difficulty in concentration. This person is absent-minded. So the being absent-minded may also be the anxiety disorder, because trouble focusing on concentrating due to anxiety. You may find that this person will just be absent-minded. Uh, that can be because of fear and also anxiety. Then there is also sleep disturbances, difficult falling asleep or staying asleep due to anxiety. That's where now this person is failing to sleep because he's afraid. When somebody is yeah, has got a challenge, is afraid of something, or is maybe is anticipating something to happen, then they'll have what is called sleep disturbances, this sleep disorder. Then there is also physical symptoms, which can be rapid heartbeat, where a person, you see the heartbeat is fast. Then there is sweating, then there is trembling. This person is just like traumatized with trembling. Then there is other physical symptoms that you can be able to find them in the book. So these are some basic things that you can be able to see that this person is suffering from anxiety disorders. What are the causes and risk factors for anxiety disorders? The causes are maybe genetical. Family history of anxiety disorders can increase the risk. So there are people that come from the family where there are so much anxiety, there is so much anxiety, there is so much fear. It is genetical, or they, you know, there is what we say threshold, or there are people that have got high and low threshold. That is the ability to endure. So now some are, it seems like anxiety disorders. Others, it is because of genetic disorders. They are so anxious in their family, and it's easy. They are easily irritated. They are easily facing anxiety. They are easily having fear. Then there is brain chemistry, which is imbalance of neutral neurotransmitters such as serotonin and GABA, GABA. So this also may cause disorder when if neurotransmitters, like they are transmitters, they are neurons. So if the neurons are not at ease, it may cause also disorder, because the neurons are the ones that communicates to the brain to react. So they may be that. Then there is life experience. Maybe one faces a certain experience in life which may cause anxiety disorder. This person, it may create fear. It may cause this person to be afraid of anything, thinking that something bad may happen. So these are significant life changes where a person, because of what a person has gone through, it has created fear of something, fear of a lot of things. It may have created fear of people, fear of what. So that may be the cause of anxiety or disorders. So we have said genetic, brain chemistry, and also life experience. Now, risk factors, the family history, having a first degree relative with an anxiety disorders may also be, may create such disorders in an individual, because you see that in the family maybe there are such challenges. People are afraid, people have got that fear. So that may also, when you look at that, you may find that the people that have got that blood, that genetic, they may experience the anxiety disorder. Then trauma, experiencing a traumatic event also has a person who go through a certain experience which is traumatic may experience this disorder. Then there is stress, ongoing stress or significant life changes whereby you are so much stressed time and again because of the situations that one is going through. So it may cause what is called anxiety disorder. Then there is personality traits. There are certain personalities, like perfectionists, which is melancholies, and they try to be perfection. So because of that, when they are not satisfied of something, they begin to have that fear, they begin to have that lack of confidence, and it creates the anxiety and self-esteem. So it may also cause that. And also those that have got the phlegmatic, those that have got low esteem, it may also cause, because the anxiety disorder, because they are afraid of people, how people will say, what the society will think about this and all that. What treatment can be used for this disorder? There is what is called psychotherapy, which is the cognitive behavioral theory. So in therapy, we have got what is called cognitive behavioral therapy, which helps individuals change negative thoughts, patterns, and behaviors. So that is where now you, as a psychologist, you have to help this person to become positive through counseling session with this person, or psychological session. Then acceptance and commitment therapy helps individuals accept and manage anxiety. So you help a person to accept the situation and to which can help in managing anxiety. Then there is medication. Then in medication there is medicine which is called benzodiazepines, which they are given. So medications that can help reduce anxiety in the person. These are called um, these. So these type of medicine, they help to release anxiety, and they help you to cope up. So they will be able to relieve the brain, the neurons, and the brain flow, so that your nerves are released in the brain. Then there is selective serotonin, which is also the medication which is used to reduce the anxiety. Then there is also the therapy which is called lifestyle change, whereby somebody just doing the exercises may reduce this anxiety. So regular exercise can help reduce anxiety, and also the relaxation techniques like breathing, and also whereby meditation. So these techniques such as deep breathing, progressive muscle relaxation, and meditation, they are also helpful in reducing these anxiety disorders. Then there is also sleep hygiene, which is establishing a consistent sleep schedule and creating a relaxing sleep environment. That is also a therapy that can be used. There are other alternative therapies, which is the mindfulness based therapies, which is therapies that focus on mindfulness and relaxation, whereby you just become quiet and you look at the moment instead of looking in the future or in the past. You just live for that moment to just say, this is the best moment that I have. That is mindfulness. Then there is herbal supplements, certain herbal supplements such as passion flower, and there are other flowers. There are other herbals that helps in anxiety therapy. Then there are other like energy drinks. Just one takes the energy drinks. Then also just going into worship for those that are Christians, you just prayer and other other methods can be used where you just go to church, you go to gym, you go to um, you meet your friends, you just discuss about other things. There are also all alternatives for therapies for anxiety disorders. So anxiety disorders are common mental health conditions that can significantly impact an individual daily life. Understanding the definition, symptoms, causes, and risk factors can help individuals seek effective treatment options, including psychotherapy, medications, lifestyle changes, and alternative therapies. So, you as a psychologist, you need uh, to know when you're diagnosing this disorder, you need to give option to your client on how they can be able to handle and deal this kind of disorders. So, yeah, for more things, if you want to know more about and other alternatives in abnormal psychology, you can order this book, which is Abnormal Psychology by which I've written. So I've put in things that can help you to deal with mental disorder or uh, what is called anxiety disorder, and also you can be able to help others and the alternative that are there in mental disorders. So this is your host, Dr. Tulipo Mwenfubo. Let's meet in the next class. Thank you so much and God bless you.